Good afternoon, class. My name is Courtney Anthony, and I will be presenting child abuse in rural America. What is child maltreatment? So the definition of child maltreatment is child abuse or neglect, which includes any parent or caretaker's action or lack of action that results in serious harm or creates an imminent serious danger to the child's well-being. The types of maltreatment are neglect, which is when someone has not been cared for properly; physical abuse, which is the intentional act of causing injury or trauma to another person through bodily contact; sexual abuse, which is abusive sexual behavior by one person forced upon another; and emotional abuse, which is a pattern of behavior where a perpetrator insults, humiliates, or generally instills fear into another person in order to try to control them. So, key challenges and risk factors of the rural landscape are geographic isolation. That is, the physical distance limits access to formal and informal supports. Poverty and unemployment. There are high rates of persistent poverty and limited economic opportunity in rural areas. There are service gaps, which is shortages of mental health providers, substance treatment centers, and pediatric care. And anonymity versus visibility. There is a lack of anonymity, which can deter families from seeking help, but low population density can also reduce the number of eyes on the child. So the theoretical framework that I will be discussing is ecological systems theory. This theory was developed in the 1970s by psychologist Erich Bronfenbrenner. Ecological systems theory's core concept is that maltreatment or neglect is not the result of a single factor, but the results of interdependent risk factors operating across multiple environment levels. So according to Sabri et al., the ecological model explains that a child's risk of violence is influenced by factors at four interacting system levels: the individual, the relationships, the community, and societal norms and policy. The four key levels are the microsystem, which is the child's immediate environment and school; the mesosystem, which is the home and school relationship; the exosystem could be the parents' workplace or community services; and the macro system is economic policy or the child's cultural norms. So key influences at the level one microsystem for risk of child abuse are parental mental health issues, substance use disorders, high parental stress due to economic strain, intimate partner violence or domestic violence, lack of parenting knowledge and support, and peer groups or bullying of the child in school, and the child not having good interactions at school with teachers or coaches. So key influences or risk of child abuse at level two, the mesosystem, would be that the mesosystem relationship is often weak or non-existent. This would mean that the parents do not have a good relationship with the school. The family is often isolated, and there's a geographic distance between receiving services. There's a lack of community centers. The family has no support systems. And again, there is a sparse link between parents and school. The family often distrusts and fears mandatory reporters, which are schools, doctors, social services, and that can lead to a reluctance in seeking help. And often there is a stigma behind reaching out for help. So there is a lack of anonymity in small towns, um, and there is often dual relationships between the parents and caseworkers. And according to McGuire, Jack, and Kim, poor perception of the child welfare system's helpfulness or appropriateness in rural areas reduces the likelihood that individuals will report child maltreatment. So external factors at the level three exosystem that places stress on the family could be limited infrastructure, which is a lack of transportation or limited broadband, economic instability. There is high unemployment and limited jobs in these areas, inadequate services. There are few or no providers for mental health or addiction, and lack of quality childcare. There are shortages of affordable and adequate childcare, and early intervention programs in rural areas. The influences at the level 4 macro system are socioeconomic disadvantage. There is a lack of federal or state policies that address generational poverty in rural areas, poverty and self-reliance norms. There are strong cultural norms on family privacy and not involving outsiders, and these families are self-reliant, and there is a risk of alcohol and drug availability. There's a normalization of substance use in some rural communities. So a policy that I will be discussing is the Child Abuse Prevention and Treatment Act, which was first enacted in 1974 and has been amended and reauthorized several times. The purpose of this act is to provide federal funding to states to support prevention, assessment, investigation, prosecution, and treatment of child abuse and neglect. Its core role is to set minimum national standards for child protective services systems such as CPS and DFACS to qualify for federal funding. CAPTA's current key provisions is 1, it requires states to have procedures for mandatory reporting of child maltreatment. 2, it requires states to develop a plan of safe care for infants born affected by substance abuse or have withdrawal symptoms, and it mandates referrals to early intervention services. 3, it requires provisions of a guardian ad litem or a court-appointed special advocate for the child in all judicial proceedings involving abuse and neglect. And 4, it requires states to submit data to the National Child Abuse and Neglect Data System. How CAPTA funds state systems. So 1, there are state grants, which is the main funding stream. 2, there are competitive grants for research, demonstration projects, and technical assistance. 3, there is the Children's Justice Act grant, which supports improvements to judicial and investigative systems involving child abuse, and it focuses on child victims. And there are community-based child abuse prevention grants. They are community-based primary prevention programs and are often delivered through local resource centers. So challenges of CAPTA policy in rural areas are limited availability of a specialist, travel barriers, lack of infrastructure, high staff turnover rate of caseworkers or social workers, funding disparities. This means that a lot of the policies funding or grants go to urban areas where there are a majority of clients that they can serve, and fewer community services are available in rural areas. Core roles and responsibilities of rural social workers in child abuse practice are to investigate and assess investigating reports of abuse or neglect and determining if the child can remain safely at home. Social workers provide crisis intervention, which is responding immediately to a crisis situation and determining the child's safety and providing support. They provide case management, which could be meeting with the family and developing a case management plan. The plan could include parents completing parenting class, individual counseling, substance abuse treatment, etc. Social workers advocate for clients. They advocate for the child's needs within school, legal, healthcare, or social service system. And they also are a resource connection by guiding the families to essential resources like emergency housing, legal aid, and other community-based services. In summary, child maltreatment in rural areas is exacerbated by interconnected risk across all ecological levels, particularly isolation and limited resources. Future capital reauthorizations and state plans must prioritize funding streams that specifically address the geographic isolation and service deficits unique to rural communities. These are my references, and I hope you guys enjoyed my presentation. Thank you.